So the prokaryote that we were given was Enterococcus faecalis. A little bit of an introduction to this prokaryote is that the specific name is Streptococcus faecalis. It is classified in the domain and kingdom of bacteria. The phylum characteristic is Spermacutes, which is previously known as Bacillota. The class of the species is Bacilli. The order is Lactobacillus, and the family is also classified as Enterococcaceae. The genus is Enterococcus, and there are said to be 58 different species, with the E. faecalis being the main species. Next, looking at the life cycle of this bacteria, it starts to colonize in its living spaces first. After, it tends to act as an opportunistic pathogen that tends to thrive on people that are said to be more prone to infections and other chronic diseases. After, the bacteria goes on to the stage for like long-term survival and is able to spread in various ways. The bacteria is also able to live in very strong environments, and due to this, it's able to create biofilm. So after looking at, where this bacteria lives, it lives like mostly in the intestines, specifically in the GI tract. It also lives in parts of the mouth and the vaginal genitals, but is said to be very unharmful to the body. However, it is able to spread to other parts of the body and become pathogenic under particular conditions. It can get into your blood, wounds, urine, and after, it tends to spread to the other sites within the body. And this is what causes greater infections such as sepsis, meningitis, and more infections. This is also because it has a more flexible metabolism that is also able to adapt to many different environments. People that are healthier normally don't have to worry about this bacteria spreading at all. It is just more prone to the people that are considered more vulnerable to serious health conditions. Also, it is said that this bacteria is very hard to kill off. It's very resistant to antibiotics, so when people contract it, it gets a little hard to get rid of as well. Next, looking at the general shape and arrangement and also the gram status. So when looking at this bacteria under a microscope, it displays gram-positive characteristics, and we know this because it stains purple when utilizing a gram staining technique. It also has an arrangement of being in short chains or pairs that are gray and small. They can also be described as being cosy, which means that they're ovoid or like spherical. The bacteria is also not considered to be spore forming as well. So looking at the disease and medical conditions, the bacteria tends to cause lots of urinary tract infections, and is said to be the second to third most common agent that is located within the UTIs. Additionally, this bacteria also causes endocarditis, which is like inflammation within the lining, within the heart and the valves. It's said to be rare, but it tends to happen. Another one is bacteremia. And there are also other wound infections that, the bacteria can spread in. So maybe when there's like an open wound, maybe after surgery or something, the bacteria can spread within that infection. It is also involved in other infections that are located within the pelvis and the abdomen.
So for the symptoms, it really depends on the site of infection. So there's urinary tract infections, which consist of painful urination, frequent urge to urinate, a cloudy and bloody urine, and then bloodstream infections, which is like that bacterium or sepsis, consists of fever, chills, rapid heartbeat, and low blood pressure. And then endocarditis which is like a serious heart infection, causes like fatigue, shortness of breath, and heart murmurs. And then you have wound infections, which consist of redness, swelling, pus, and delayed hearing. And the diseases progress depending on the patient's health status, and with immunocompromised individuals, it can be at a higher risk of severe complications. Treating Enterococcus faecilia is tricky sometimes, as it is resistant to vancomycin, but typically ampicillin or vancomycin is combined with gentamicin for severe infections. And if it does show that it is resistant, other medications such as linezolid or daptomycin or trigacycline can be used. And then, like I previously said, Enterococcus faeciei can be resistant to vancomycin, known as VRE, or vancomycin resistant enterococcus. And it can also be resistant to cephalosporins, fluoroquinolones, and aminoglycosides, which were not used, which only if they were not used in combination therapy. Um, Typically, everybody has Enterococcus faeciei present in their body, specifically in their mouth and their gut, but it can become pathogenic when it enters areas of the body where it doesn't belong, like the bloodstream, urinary tract, or even surgical wounds, and is typically contracted through direct contact with contaminated hands or surfaces, but it can be contracted through food or water or even some medical procedures, like inserting catheters. And then, in order to prevent this, proper hygiene in hospitals, like hand washing and sterilization of medical equipment, will help prevent outbreaks. Oh my god. Enterococcus faeciei is known for its antibiotic resistance. It contains many intricate resistant mechanisms, which is combined with its habit to be able to gain newer resistance genes. The resistance genes come from transposons or plasmids. And then Enterococcus faeciei is very tough as it can survive extreme conditions like high temperatures, acidic environments, and even some disinfectants. Since it is so resilient, it can survive in hospitals for weeks, making it difficult to control in healthcare settings.